focus on employee health, but also we provide services to
like I mentioned before, we utilize onboard resources. So we have a medical board.
Thank you very much, and thank you for inviting me to Fly Health, and also to TruDoc for sponsoring the session. We're going to have a bit of a tag team here. I won't be speaking for very long because I think most of the interest is going to be around the technical side of the telemedicine. As I mentioned, I'll just repeat, so I won't be speaking for very long. I'm just going to do a very quick overview of Emirates Group Medical Services, and then I'm going to hand over to my colleague, Dr. Azeem, who is the expert and currently is the main operator of our Inflight Telemedicine system. So to kick off, just to give a very brief overview of who Emirates Group Medical Services are. We operate all of the health services for Emirates Group, which includes Emirates Airlines, which you're probably familiar with, I would think, and Donata, who are the main ground handler, both we operate obviously within Dubai and across the Middle East, but we also operate globally. We currently employ about 140 different nationalities within the company, and our role as Emirates Group Medical Services to fund, so we are self-insured, we have our own insurance program, and we also provide services through a range of clinics for primary care and also for aviation medicine. We currently have about 250 staff working within Dubai, and then we have another 100 staff who operate remotely, primarily out of the Philippines, and they provide administration support to us. And we see about 25,000 patients a month, and we process about 49,000 claims per month as well through our insurance system. So we provide a range of services, and one of the things that I've just put up here is essentially it's around providing an integrated health service, very much focused on employee health, but also we provide services to our dependents, and we're about to undergo a significant expansion. We've decided that as part of from a strategic perspective, as part of Dubai 2030, to meet the needs of our population, that we're going to need to start building all of the resources and putting in the capabilities that will enable us to get ready for that. So in the next year we'll add a few more clinics, and then we're going to put in some what we call rather large polyclinics as we get ready. At the moment we have about 4,500 pilots and about 23,000 cabin crew on the airline side of things. And we anticipate that by about 2030 we'll have about 45,000 cabin crew and about 10,000 pilots. And then our overall population that we'll be looking after at the end of 2024, I think we were looking after about 89,000 people. We expect it to be about 120,000 people by the time we get to 2030. So we're looking at what we would consider to be a significant expansion. This is just an overview of some of the services we currently operate. So we have 5 clinics at the moment. We have 9 clinical services, which we've got up there, everything from primary health care. We have a fairly large primary health care contingent. We have about 50 doctors. We expect that we'll probably, within the next 2 to 3 years, increase that to between 100 to 150 doctors. We have a full range of services around clinical services, but also the employee. We operate a small central lab, some pharmacies for each of the clinics that we currently have in place. And as I mentioned before, we are self-insured, so we have a medical insurance system that is currently providing all of the medical insurance services to both our employees but also for our family members. Two of the unique things that we operate, we have our own employee assistance program, which essentially is very similar to having a social work program on board. So it does traditional employee assistance but also provides a lot of social work capability. But the big thing, and that's what I'm going to hand over Azeem to, and what is most pertinent to what we're talking today, is MedAssist. So MedAssist is a service that we use to provide down route telemedicine and consultation capabilities for all of our people who are travelling. And at any one time today, for instance, there'll be 15,000 of our employees throughout the world, primarily category pilots, but we also have a lot of other people doing business around the different countries, and they access service through our main network provider, which is our own MedAssist. And then I'll hand over to Dr. Azeem.
Thank you very much, Richard, for that overview. Alright, so thank you for the invitation as well, DJ, to discuss the telemedicine. This is just the agenda, and that's a photo of Richard when he started at Emirates. This is a brief history of what we do in terms of in-flight medical emergencies. I'll go through the role of the ground medical services, a bit about the telemedicine devices of commercial aviation. So if you had an in-flight medical emergency back in those days, an expedited landing or diversion would have been the best course of action. And if you fast forward to today, a diversion is now the last resort for an acute in-flight medical emergency. And why that came about was because of telemedicine. There were emerging ground medical support services like ourselves in the 1980s, and they were providing assistance to the aircrew in flight. What also assisted was the expansion of a medical kit led by the FAA in the US, and that kit and the medications that we use in flight kept expanding, improving for the types of emergencies that they were dealing with. And now, as you can see, a diversion, which is a very impactful decision, is now a last resort. We have a hub based here in Dubai with expert physician-led care, and we're able to help with an onboard plan of care. We optimize medical volunteers if required, and we make recommendations to push on or to divert, and we're consistently capturing data. The cabin crew are able to connect with ground medical services with technology called Satcomm. They can also use text technology from the cockpit called ACARS, ACARS, if that doesn't work. And our new telemedicine device as well, which requires a robust internet connection, is the other option that we have. At GMS, or the Ground Medical Support, we're doing more than just the in-flight medical emergencies, which is a big part of what we do every day. We're doing pre-flight screening for our passengers. We're mobilizing emergency medical services on the ground. And like Richard said, we have 24/7 crew support for our sick crew outstation. We're interacting with many other services within Emirates. Notably, our network control center, we work side by side with our network control center, and that model works really well for us. We're able to move our resources and make better decisions that way. This is a look at our passenger network. So in a 24-hour period, we're moving more than 100,000 passengers around the world, and at any point in time, and this is what we're managing. It could be our cabin crew, it could be our passengers. It's quite a large network for Emirates, and we manage it every day with the help of telemedicine. If you look at what we manage on the ground here at Emirates, on our team, you can see for 2024, the total number of cases, this is in-flight or pre-flight screening, more than 20,000 cases in 2024. That dip you see after 2019 was the pandemic, and then it picked up again after that. Like I mentioned, in-flight medical emergencies is our main service that we provide, more than 16,000 cases in 2024. And what we're looking at mainly would be things like vomiting, with dehydration, fever, abdominal pain, fainting, mild allergic reactions in flight. We do get serious medical emergencies, and we also have protocols to manage that as well with our well-trained cabin crew. Some of the challenges that we face, it's similar to what I've seen from the previous speakers from GEMS. Look, it's involving our communication, seamless communication between our flight crew and our ground medical teams, making these real-time decisions for the in-flight medical emergencies. For my team and my doctors, getting all of the information is really important. So getting vital signs, the information from the passengers, getting those details would really help us to make the best decisions and our recommendations. technology integration, we've had the same sort of challenges in terms of connectivity, implementing and maintaining telemedicine capabilities, problems with cybersecurity, firewalls, and connectivity continues to be some of our challenges, but we're working through that. So, to our telemedicine device, revolutionizing passenger health, innovation in passenger health management. Telemedicine devices in flight, it's not new. There was a Tempest machine that was rolled out many years ago. This year would probably be about 25 years since Tempest was probably rolled out. And what have we made for 25 years since we've had the old Tempest machines? We can make the devices smaller, we can make the connection between each device with Bluetooth, and we can make it cheaper. So that's what we're going to over the years, and that's what Emirates is implementing and making some of these devices work better for us. Outstation that we have in flight and we're rolling out into our fleet at the moment, as we speak, is a touchscreen tablet, lightweight. We have a 12-lead ECG with no consumables, which is a huge advantage for our kit team. We have a thermometer, pulse oximeter, blood pressure monitor. A telemedicine station looks really great, but what you do with the information really matters, and that's where our team comes in. And so everyone who gets the information can make decisions, but we're making the best and better decisions based on our needs as an airline. And as you can see here, the cabin crew wants to put in data from the telemedicine kit. That most of the data can be input via Bluetooth, and if that doesn't work or there's an issue, we can manually put that in. The crew can then request a call from a GMS team on the ground in Dubai. This is what it looks like for the tablet. So it's called MedCapture, and this is what it looks like for the cabin crew. It's very tactile, it's an intuitive interface, and it's made like that by design, so it's easy to use. They can connect by Bluetooth wirelessly to medical devices. There's an integrated way of conferencing, calling by audio or video with our team on the ground. And it communicates to our team on the ground via the fastest cloud and to our physicians that help with the decision making. On the ground, this is what it looks like for the physicians and case coordinators to get information. We get the vital signs, and we're able to then give a recommendation to our crew utilizing the resources that we have on board from our medical kits and how they're trained to assess and help our passengers. Now, just switching gears to our air crew and our cabin crew who or may be sick outstation. How do we provide some remote healthcare support for these crew that could be anywhere from Bangkok to JFK? If it's a minor condition, we have our medical teams that can assist and give some recommendations on how to manage for the first 1 or 2 days. And if they need further assistance as well, like